Dr. Cary Gans, and I'd like to give you a little bit of an introduction on dental implants, because there's a lot of confusion out there about what you can do and what you can't do with dental implants. So let's give you some basic, real down and dirty information. Well, with dental implants, the first thing we want to do is dispel some myths. So let's talk about them. The first one is that dental implants don't work. Well, that couldn't be further from the truth. We've been involved with dental implants now for probably, 25 years. And all different types of implants. And a lot of the misconceptions that are around today relate to the dental implants that were done 25, 30 years ago. And truthfully, a lot of those didn't work. They were good attempts, but they just didn't last. Well, osseointegration, which is the term we use for implants that are used today, or root form implants, have a success rate that is tremendous. Now, once again, that depends on a lot of factors: your health, the amount of bone that's available, the surgeon that's placing it, the way they're used, etc. But implant success rates are in the 90+% range, which is kind of terrific. So, truthfully, implants work. Implants are costly. Well, I guess that's a relative term. What's the cost of good dental health? What's the cost of being able to chew your food? What's the cost of being able to look good? And what's the cost of being able to either totally eliminate the need for a denture or a removable partial denture, and the ability to have a full complement of naturally looking teeth? So cost is a relative term. Sure, it's more costly than some other things, but well worth the time, the effort, and the money. Dental implants are experimental. I've heard that numerous times in my practice. Well, that couldn't be further from the truth as well. Dental implants today are as predictable as any modality we have. They've been used for 25 years, give or take. We've had tremendous success. We've utilized thousands of implants during our career, and they are definitely not experimental. Dental implants can be rejected. Well, that's not true. Dental implants cannot be rejected like an organ transplant is rejected. Dental implants can fail due to mechanical ineptitude of the surgeon. They can fail because of poor bone and health of the recipient. They can fail mechanically. But dental implants are not rejected. They're made out of pure titanium, medically pure titanium, and do not get rejected. So that's a myth. And dental implants are painful. Well, first of all, once they're integrated and being used, they're part of your mouth. You don't even know they're there. And for some reason, even during the surgery, now I'm not going to belittle the surgery itself. Sometimes the surgery is a little complicated, and you'll have some sutures, but it's not all that terrible. It's dental surgery. This is not open heart surgery. So although it's uncomfortable, a day or two after the implants are placed, you're back to work doing what you normally would do. Well, those are what dental implants look like. There are different types, different sizes, different shapes, etc. But that's pretty much what an implant looks like. What you're seeing there is the implant and the component that we use to hold the cap. Now, how are they basically done? Well, it's real simple. First and most important step in placing dental implants is the diagnostics. The dentist that you're working with needs to work with a surgeon, an oral surgeon, or a periodontist, and needs to sit down and fully diagnose what your condition is, what your wants and needs are, where the implants are going, what they're going to do, and what the goals are. That's critical. They then need to develop a plan to put that into effect. You just can't go into a surgeon today, or you shouldn't, and just have implants placed willy-nilly. That will create problems. If you want a predictable result, you've got to go through these steps. So the first step is the diagnostics and treatment planning and a coordinated effort between the surgeon and the restorative dentist. Then basically the surgeon, will drill a hole. He'll then thread an implant into the hole. He'll then cover that over with gum tissue and allow that implant to cook in your jaw from anywhere from 3 months to 6 months, sometimes a little bit more, a little bit less, depending on what the process is. Then the restorative dentist will put a cap on it or some type of restoration depending on what your wants and needs are. And it's not the purpose of this little video, but you can use dental implants in lots of different ways. They can be used to put regular teeth back in, a cap. They can be used to restore an entire mouth with caps. They can be used as an adjunct to a removable prosthesis to give you what we call primary retention, meaning it helps hold the denture in your mouth. So here's a single tooth that's going to be replaced by an implant. Or you can go ahead and support a denture or even a full arch. So here's an example of an overdenture where a denture, that's plastic teeth on a plastic denture, but it clips onto that bar that you see in gold, And that bar then allows the denture to have primary retention. There's something physically holding it in your mouth. Sometimes you can even remove the palate from an upper denture. There's an example in the lower jaw of what we call a fixed detachable, where that is actually screwed into the patient's jaw, not removable by the patient, but removable by the dentist for maintenance if necessary. But that is cemented, that's actually screwed into the jaw. The denture is screwed into the implant screwed into the jaw. The benefit here is that lower dentures typically are not wonderful. So if you can screw something into the lower jaw so it's not removable and not sitting on gum tissue, that's a tremendous advantage. And finally, you can see here's a patient with a whole bunch of implants in the upper jaw and a bunch in the lower jaw, and all of his teeth are being replaced by implants. This gentleman was wearing dentures and was breaking them, could not wear them, and now he's got a full complement of teeth supported by dental implants. Okay, just tell me, Mike, what you just said.
I am very happy with the job you did in my mouth. I think you did an excellent job, and I couldn't imagine anyone doing a job as good as that.
Well, thank you. What did you have done?
I had, if I remember now, 12 implants on the top, and I think 6 or 7 on the bottom, and you totally reconstructed the whole mouth.
And it's been several years?
Yes, it's been, well, actually at least 4 years since you're done, and I'm just very happy.
Can we do it again?
Oh, absolutely.
Okay. That's what
Absolutely.
Now, because we're going to put this on YouTube and on the website, so make sure people know that you're real happy.
I am.
Okay, thank you, Mike.
Okay.
Well, you can see this is the gentleman that had all those implants placed, and he couldn't be happier. He's out there eating his food, not worrying about his denture cracking, not worrying about teeth coming out of his mouth, laughing, and having a denture fly across the room. He couldn't be happier. And that's the gentleman. So, if you're interested, give me a call. Now, if you'd like to come to New York, you can come in for a complimentary consultation. We'd be happy to take a look at you, talk to you, let you see what's going on. We can give you some advice. If you're we practice at Garden City, New York. There's our phone number, 516-741-1230. We're located at 300 Garden City Plaza, Garden City, New York. We're about a half hour outside of Manhattan by train. You can fly into LaGuardia, you can fly into Kennedy Airport, you can fly into MacArthur Airport on Long Island, and we'll work our schedule around you. So we'll be happy to see you no matter where you come from in the country. If you want to get some more information about us, or about almost anything else you can think about in dentistry, please go to our website at gansdental.com. Thanks so much for listening, and have a wonderful day.